We're at the Tygerberg campus of the University of Stellenbosch's Faculty of Medicine and Health Sciences, where an incredible medical breakthrough has just been announced. I'm joined by Health 24's resident doctor, Dr. Owen Visa, who's going to speak to us about this extraordinary medical effort. Dr. Visa, thank you so much for joining us today. Now, what was announced today, and tell us, why is it so extraordinary?
I think first of all, today I'm a very proud Māori. I graduated from this university and this faculty, and I think this breakthrough is a world first. They announced the first successful penis transplant that was ever done. It was done previously, but due to a lot of reasons, the transplant was removed. I think it's important, as Professor said earlier today, that in our context this is important, because we see so often with ritual circumcisions that there comes problems along with it, and I think this is important to give a new hope for those patients that are involved in this.
In fact, it's particularly important for the South African context, as you mentioned, and all of the participants in the study, I think there's 6 lined up, are patients who've had their penises fall off, I suppose, or they've lost their penises from ritual circumcision. So this is significant for South Africa.
Definitely. What usually happens, what I also came across while I was doing clinical practice, is that with the circumcisions, especially the ritual circumcisions, often these patients have gangrene of the penis. It usually starts with sepsis due to it not being sterile environments, and then a whole lot of range of factors that's involved here. And then what often happens is that gangrene sets in, and then eventually the patient loses his penis. In our setting, this is of particular importance, as a penis, although not a life, it's not necessary to sustain life, it's specifically important in the quality of life that these patients have.
Now, this really was a medical feat of note, because this was complicated surgery, and of course surgery that had never been done successfully before. Won't you talk to us through the technicalities, explaining to us why this was so complicated?
I think when it comes to transplant medicine, there's a couple of important things. The first one is obviously to find a donor, and as Prof also said, it's not that easy to come across a donor that will donate his or his penis. The second important thing is with the blood supply. It's in all transplants, the blood supply is a crucial part of a successful transplant. And the third important thing is, especially when it comes to the type of transplant that you need to do, where there's more than one tissue involved, including skin and nerve and also the blood vessels, it becomes particularly more difficult. And I think what makes this remarkable is that they could actually do it, immunosuppress the patient, and then also sustain a sufficient blood supply and finding a donor. So I think this is exactly why this is such a successful, very successful accomplishment for the university and for professors.
And for you, you must be particularly proud to be a part of the South African medical fraternity.
Definitely, especially because I often saw what the impact of this type of procedures will have on a patient's life. Even a small life-changing procedure makes a huge difference in the patient's life that we as the medical professionals often don't see. And I think this is why this is very important, because the patient will eventually go out and live a very happy, quality life.